Hello everyone, you're watching Physio Classroom channel, and in today's video we are going to cover the important treatment techniques that can be used to treat cervicogenic headache. Now all the treatment techniques that will be demonstrated in this video are directed towards treating the dysfunction that is present in the upper cervical spine, especially in the C1 C2 motion segment. Now the first technique that will be demonstrated is known as the forearm traction technique. For this, the patient is made to lie down in supine lying and the therapist stands towards the head end of the patient. The therapist now bends from the knees and places the radial part of the proximal forearm under the cervical spine with the forearm remaining in mid-prone position so that the radial border is anchored along the base of the occiput. The other hand of the therapist grabs along the chin of the patient and the elbow is also supported on the couch. Now from here the therapist can deliver traction to the upper cervical joints by strongly pronating the forearm and at the same time shifting the body weight back. Now this traction can be delivered in an intermittent fashion or as a static traction. Now this technique helps in opening up the jammed upper cervical joint facets and thereby helping in the relief of pain. Now the second treatment technique for cervicogenic headache is C1 rotational mobilization technique, and this technique aims at improving the upper cervical rotational ranges between the C1 C2 joint. Now this rotational mobilization technique should be performed on the day when patient is not experiencing headache. So to deliver the rotational mobilization to the C1 posterior lateral arch, the therapist first look for the mastoid process and then follow the line obliquely and downward to reach the base of the skull. Right here, the therapist needs to place the pulp of the thumb and then confirm the position by movement testing. So with the right thumb placement, the therapist can feel the C1 posterior lateral arch moving away during the initiation of the contralateral rotation and the C1 vertebral arch approximating with the palpating thumb during ipsilateral cervical rotation. So if the patient is having a left side rotational dysfunction, then the right side C1 vertebral posterior arch needs to be mobilized. So the mobilizing thumb is reinforced with the thumb of the other hand and a posterior anterior pressure is applied to glide the C1 vertebra anteriorly. So the direction of the force is towards the angle of the jaw. So while this mobilizing force is maintained, the therapist asks the patient to perform the offending rotational mobilization and therapist follows the movement. At the end range, the therapist can also ask the patient to perform passive pressure to further maximize the effect of this rotational mobilization technique. The glide is maintained until the patient reaches back to the neutral position. Now the third and fourth treatment techniques can be given as home exercises for the patient, and both the techniques aims at correcting the positional fault that exists between the C1 and C2 vertebra. So in the third treatment technique, the patient is instructed to place the edge of the towel, or in this case I have a mulligan strap with me. So this needs to be placed right above the C2 spinous process and the patient is going to hold it with both the hands. Now with the straps positioned at the level of angle of the jaw, the therapist has to instruct the patient to glide or push the C2 spinous process anteriorly and at the same time perform the chin retraction exercise. Now patient can be instructed to perform 10 to 15 repetitions of this exercise in a single session and can do it twice or thrice daily. Now in the fourth treatment technique, we have to utilize the similar kind of exercise, but this time we are going to place the strap over the C1 vertebra. And now the patient has to be instructed to push the C1 vertebra anteriorly and hold it for a second or two and then again perform the same repetition. So in addition to this, the oscillatory gliding technique that was described by me can also be utilized to correct the positional fault between the C1 C2 motion segment. So this was all about the important treatment techniques that can be utilized to treat cervicogenic headache. I sincerely hope that the information shared by me in this video is going to be helpful for physiotherapy students and young practitioners. Do keep motivating us with your comments and feedback. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.